You're listening to Clinicians Roundtable on ReachMD. On this episode, we'll hear from Dr. Christopher Cann, who's an assistant professor in the Department of Hematology Oncology at Fox Chase Cancer Center in Philadelphia, where he's also the director of the Young Adult Cancer Program. He'll be discussing the quality of life implications from delayed colorectal cancer screening. Let's hear from Dr. Cann now.
So even just talking with stage 3 or resectable stage 4, where there is some areas that could be resected and potentially have curative intent, the surgery in and of itself becomes more extensive. So if we think about stage 3 cancers, it requires more lymph node dissections. It potentially requires, depending on where this is, an ostomy, which depending on where the tumor is, can be permanent or will eventually be reversed after chemotherapy is used. And that's the next component of this. Chemotherapy for stage 3 and stage 4 in colorectal cancer is the general recommendation. For stage 3 cancers, you're looking at generally 3 to 6 months of chemotherapy. And so from a quality of life perspective, we're saying that you're coming in to get regular chemotherapy that has side effects, fatigue, GI side effects such as nausea, vomiting, diarrhea, low white blood cell, red blood cell counts. And one big thing is peripheral neuropathy from the oxaliplatin-based chemo that is standard of care. That has a cumulative effect over the course of time, but that could be a side effect that is potentially permanent, and that quality of life issue can last, forever. From a stage 4 standpoint, if there is a potential for cure in the sense of there is limited disease spread potentially to the liver or to the lung, not only does that require resection of the primary tumor, but resection of areas of the liver, resection of areas or radiation to areas in the lung, if those are the areas of spread. So the extent of surgery and the recovery time becomes significantly longer, and complications obviously potentially increase as well the more that we are going in surgically involved. And then if we're in a situation where we are not able to cure this cancer in the stage 4 setting, that's where lifelong chemotherapy is needed. And so from a quality of life perspective, we're obviously taking into account how we balance quantity of life by prolonging through chemotherapy with the quality of life that the chemotherapy can provide by improving symptoms, but also the negative quality of life effects from the side effects of chemotherapy. And so this could be something that patients are dealing with lifelong for years, and it limits their ability to potentially work or spend time with their family the way they want to, vacation. And young patients can affect their fertility, which is one big issue we like to always address with our young adult patients, is that these chemotherapies can have permanent effects on your ability to have a child in the future. So all that being said, it's really focuses on the fact that how screening is so important to catch these things early to limit the potential quality of life issues that are associated with surgery and chemotherapy and potentially life-limiting components of a stage 4 cancer diagnosis.
That was Dr. Christopher Cann talking about how delayed colorectal cancer screening can impact patients' quality of life. To access this and other episodes in our series, visit Clinicians Roundtable on ReachMD.com, where you can be part of the knowledge. Thanks for listening.